The Affordable Care Act's fifth enrollment season faces a multitude of challenges when it begins on Wednesday. Healthcare.gov in Indianapolis, the director of the state's largest organization helping people find Affordable Care Act insurance, had to lay off 9 of 13 staff members last month because the federal government had just taken away more than 80% of the grant that paid for their work. In Atlanta, festival-goers at the annual Pride weekend in mid-October were mystified that members of Insure Georgia had a table set up because they thought President Trump had gotten rid of the healthcare law. And across Ohio, residents starting to phone a call center for appointments with coaches to renew their coverage are being told that the service no longer exists and that, for help, they should go to a website, a hotline, an insurance broker, a county health department, or, if all else fails, their member of Congress. In the countdown to the annual ACA enrollment season that starts Wednesday, such ground-level disruption suggests that the first sign-up period of the Trump era could be as daunting as any since the fall of 2013, when the federal website healthcare.gov debuted with such serious defects that consumers trying to buy insurance were stymied for months. In recent weeks, that website has been taken down for an unusual number of maintenance sessions. Its window shopping version contained an error in calculating subsidies for certain family situations until Friday night, federal health officials confirmed. But the greatest challenges are a messy mix of higher prices and fewer options, plus less time to sign up, less assistance for doing so, and far less government promotion of the opportunity to enroll. In states that rely on the federal marketplace, more counties have only one insurer offering 2018 health plans. Avalier Health. The net effect is rampant public confusion, surveys show. And there is a broad expectation that when sign-ups end, on December 15 in all but several states that run their own ACA marketplaces, fewer Americans will have gotten ACA coverage. Unlike in each of the past 4 years, federal health officials have issued no forecast of the number of people who will be insured through the law during 2018. When asked whether such calculations have been made internally, they sidestepped the question. The Trump administration also did not provide an expected quarterly update last month on how many people were paying their premiums to keep their ACA plans in effect. The most recent figures available show that 10.3 million people were covered in March. Outside experts think enrollment will dwindle significantly. Marilyn Tavenner, the president of America's Health Insurance Plans, a main industry trade group, recently predicted a drop of at least 1 million people nationwide from the 12.2 million who signed up for 2017 coverage. A Standard & Poor's analysis predicts a drop of 800,000 to 1.6 million. Whatever backsliding occurs will stem from actions and inactions by an administration whose posture toward the sprawling 2010 healthcare law could not be farther from the cheerleading of its predecessor. While President Barack Obama appeared on the popular online comedy series Between Two Ferns to talk up the ACA and enlisted celebrities in the effort, Trump has erroneously claimed that the law's marketplaces are dead or virtually dead. A narrowed enrollment window, from 3 months to 45 days, was planned by the Obama administration for the approximately 36 states that rely on the Federal Insurance Exchange. But the change was to have begun for 2019 coverage instead, the Health and Human Services Department announced in April that it would take effect for the sign-up period starting November 1. The other impediments are all Trump administration creations. One of the most significant was the president's long-threatened move this month to cut off billions of dollars in payments to ACA insurers to reimburse them for discounts the law requires them to give lower-income customers. That action is driving a substantial increase in premiums for the most popular tier of coverage, 34% on average, according to an analysis by the consulting firm Avalier Health, and 37% according to an analysis issued early Monday by HHS. A year ago, congressional Republicans and other opponents of the law expressed outrage over a 25% average jump in rates for such silver plans. How the Trump administration is undermining the ACA. View graphic. How the Trump administration is undermining the ACA. HHS's report contains a variety of figures that cast marketplace health plans prices and availability in a negative light. It says that the average yearly insurance premium for 27-year-olds, a desirable age group because risk pools benefit from young, healthy customers, will be $4,932 for the most popular tier of coverage, nearly twice as much as in 2014 before taking federal subsidies into account. It also says that the premium subsidies for which more than 80% of ACA enrollees are eligible are increasing from $382 on average to $555, chasing skyrocketing premiums. This data demonstrates just how rapidly Obamacare's exchanges are deteriorating, HHS Press Secretary Callan Oakley said in the administration's latest bashing of the law. Most people shopping for marketplace coverage, which is available to consumers who cannot get affordable health benefits through a job, will indeed qualify for larger federal subsidies to offset the higher prices. Yet many of those who earn too much for subsidies will face sticker shock. And of the states in the federal exchange, slightly more than half will have only one insurer participating, a 21% increase from 2016, Avalier found. As prices have risen and options have shrunk, the administration has lowered the enrollment season's visibility. It slashed federal spending on advertising and other outreach efforts by 90% to $10 million. Grants for navigators, which guide consumers seeking coverage, plummeted by about 40% overall. No state took a bigger hit than Indiana, which lost 82% of its anticipated funding from HHS's Centers for Medicare and Medicaid Services. That is why Julia Holloway, who directs affiliated service providers of Indiana's Navigator program, spent her birthday on September 19 cutting the staff paid through that grant. It left her with 1 full-time and 3 part-time navigators, along with several funded through other federal programs, who will serve only Indianapolis and 2 nearby counties instead of the entire state. At the Palmetto Project in South Carolina, which has cut 62 navigators to 30 and expects further reductions once the enrollment season ends, the residual staff will be working in 17 counties instead of statewide. In the past, navigators have spread the word at the 10-day Coastal Carolina Fair. They've canceled that appearance as well as others for the coming year, including at the Hellhole Swamp Festival. "It's terribly scary," said Shelley Kenga, the project's program director, who is especially worried about what will happen in rural areas where navigators no longer will be based. She now lacks money to pay mileage for her staff to drive into smaller communities. Meanwhile, Insure Georgia has eliminated nearly 250 of more than 700 events it had scheduled for before and during the enrollment season. Though it has never done fundraising, the group is scrambling to solicit foundation donations to make up for some of its cut in federal money, from nearly $2.3 million last year to just $329,000. After laying off more than half of its 42 navigators, the group is also racing to train volunteer replacements. Alaska is also trying new approaches. Its division of insurance developed a grassroots campaign with posters that anyone can print. The Juneau Arts and Humanities Council has pledged to place those posters on every public bulletin board it can find. Across the country, the nonprofit Young Invincibles has broadened its focus beyond young adults. Filling part of the void created by the recent disbanding of another nonprofit group, Enroll America, it is operating an online Get Covered connector for consumers to schedule appointments for help in finding ACA health plans. In addition, it is running digital advertising in 10 states. The catch is whether people who see the ads or go to the online scheduler then will be able to find someone with whom to meet. The Ohio Association of Food Banks, the only navigator group working in all 88 of that state's counties, found out last month that its grant will shrink from $1.7 million to less than $500,000. Deciding that we can't deliver 365 days worth of services with only 29% of the funding, Executive Director Lisa Hamel-Fugit said the group made the painful decision not to accept the grant. She is trying to persuade libraries to spread the word. Ohio's only other navigator group had its funding cut by more than 2/3. It will work just in Dayton and some nearby communities. "It's sad," Hamel-Fugit said. "Some of the consumers who called for appointments were pretty devastated. What am I going to do? You were always there to answer my questions.